Okay guys, today we're talking about a blood pressure medication that doesn't just lower your numbers, it actually protects your kidneys. Yep, I'm talking about Losartan, one of the most commonly prescribed angiotensin receptor blockers, or ARBs. If you ever wonder why some blood pressure medications are chosen over others, or why your doctor seems to favor Losartan for people with kidney concerns, this video is for you. I'm going to break down exactly how it works, why it protects your kidneys, and what you need to know about side effects, all based on real science. Let's get straight into this, guys. All I ask from you is just to hit the like button down below. It tells YouTube this video is worth showing to more people. If you like learning about health from a scientific perspective in a calm and collected way, consider subscribing too. First, let's start with what is Losartan, which, by the way, a little over 56 million prescriptions for Losartan were filled in 2023, which goes to show a lot of people are taking this one but might not know exactly what it is. It works by blocking the angiotensin II receptor for conditions like high blood pressure, diabetic kidney dysfunction, heart failure, and left ventricular enlargement. That's a fancy way of saying it stops a hormone called angiotensin II from causing your blood vessels to constrict. When your vessels relax, your blood pressure drops, which is great for your heart. Some people also say it helps them feel less anxious too. But here's a really cool part. This same mechanism reduces pressure inside your kidneys' filtering units called glomeruli. High pressure there over time can damage the tiny blood vessels and lead to chronic kidney disease. By lowering that internal kidney pressure, Losartan slows down kidney damage, especially in people with diabetes or early kidney disease. Just keep in mind the full effects take 6 weeks, so you have to be patient with this one if you're new on it. And the evidence here is strong. Studies show that in patients with type 2 diabetes and protein in the urine, Losartan significantly slows the progression of kidney disease compared to placebo. It's one of the reasons doctors often choose an ARB like Losartan for patients who not only need blood pressure control, but also kidney protection. That is, of course, if they are not pregnant, because there is a serious black box warning on it, not to be used in pregnancy. Now let's talk about what you might notice while taking Losartan. The good news is that it's generally well tolerated. Unlike ACE inhibitors, Losartan rarely causes that annoying chronic cough because it doesn't increase bradykinin levels in your lungs. That's a huge win for people who couldn't tolerate ACE inhibitors like lisinopril. However, like all medications, it comes with potential side effects too. Most people do fine, but you should watch out for dizziness or lightheadedness, especially when standing up quickly because your blood pressure can drop a little. Another rare but serious side effect is hyperkalemia, which is elevated potassium in your blood. This is more likely if you have kidney issues or are taking certain supplements. Your doctor usually monitors your potassium levels to make sure everything stays safe, at least they're supposed to. I mean, sometimes the patient care system here in the West is flawed, but generally speaking, you should get an initial baseline test for potassium and kidney function when you start out, and the first follow-up test should generally occur 2 to 4 weeks after, or 7 to 14 days for higher risk patients. Here's another cool fact about Losartan. It's super helpful for people with diabetes or early kidney damage because it reduces protein in the urine, which is an early sign of kidney stress. By lowering that protein leakage, it actually protects your kidneys long term and reduces the risk of kidney failure down the line. If you learned something new today, or this helped you understand why your doctor might have chosen Losartan over the other medications, go ahead and hit that like button. It lets me know you want more videos breaking down what medications actually do in your body. And if you've got questions about Losartan, kidney protection, or side effects, drop them in the comments. I'll be reading and responding. Stay informed, guys. Pay attention to your health, and I'll see you guys on the next one.